Should you modify your exercise routine on TRT, Gil?
Should you? I mean, that is subjective. That is up to you. There's no rule anywhere that states that now that you're optimizing your testosterone levels, you must modify your exercise routine. Heck, there's nothing out there that says you must exercise. So in essence, there's nothing out there that says that you need to change your exercise with your testosterone level change. There's nothing out there that says you should even exercise in general with your testosterone level change. So this is all your decision. My answer to that would be simple. If you're already performing some level of exercise consistently and you enjoy it, and you feel that you now recover better, have more strength, have more desire and motivation to exercise, and you feel that you can get more out of your time in the gym as a result of your TRT, then by all means utilize that to your advantage, keeping in mind that your ego may supersede your body, especially initially. Having the motivation, especially for the guys that are older, right? We know we have some younger TRT patients. Got a lot of guys my age and up, right? 45, 55, 65, especially if they haven't exercised for years. Don't run out there and say, well, now I'm on T now, I feel good now, I'm motivated, I have the energy, I'm gonna go out there and kill it. Because you're still susceptible to all of the injuries of anyone who's not on T. And I'll even warn you that you are more susceptible to injuries, potentially, than someone who's not on T, because there are studies suggesting that exogenous testosterone or any steroid supplementation, while it does strengthen the muscles, it also potentially hinders other connective tissue strength, like tendons and ligaments. And one of the reasons that these tendons potentially may get weaker, and there's two. One is a direct effect, and I believe it has to do with a loss of elasticity due to fibromyoblasts or calcification. And the second is the strengthening and growth of muscle tissue at a faster rate than natural may not allow the other connective tissue like tendons to follow suit on the same path. So you have a tendon who's spent 30 years or 40 years here, and a muscle who spent 30 or 40 years here, and they've kind of exercised together and grown together and moved together. And now I got this muscle actually getting bigger and stronger, and this tendon can't keep up, and it snaps. So you are more susceptible to tearing injuries on testosterone than prior. So be very cautious, ensure that your sleep, your recovery, and your nutrition and your training is adaptive to what your body is telling you feel. Do not push in the gym just because you feel that you can.